How are you today? Did you get here okay?
I did. Yeah.
Okay. So this is meant to be a conversation. I'm going to ask you some questions, and I also want you to ask me questions about our program, anything that you might have read online or heard about from your other colleagues. So first, let me just ask you, how did you hear of our program?
I've been researching different places and locations, and I felt like your program had a lot to offer with the diversity of your patient population. And so that's what first led me to your program.
Well, that is true. We are a city hospital, so we do have a broad range of different type of patients that we serve. So you are correct in that aspect of our program. Is there anything else specifically that you're looking for in our program that would satisfy your needs for what you want to do?
For me also, I felt a lot of your electives, the opportunities you've had at different locations was a real positive for me because I like to see different aspects of different hospitals. I feel it's a good learning experience.
That's good. Can you clarify more? Do you mean, different socioeconomic sort of neighborhoods, inner city versus suburbs? Or?
It was a mix of the both. You had the opportunity to do academic as well as community hospital settings. For me, it was important to have both exposure.
Yeah, that certainly makes sense. That's a good idea to broaden your exposure because you don't know exactly where you'll end up
Exactly.
at the end of residency. So do you have any specific interest in mind or as far as internal medicine goes, or would you maybe want to be a generalist? And there's no wrong answer to this question, and I understand that a lot of people change their minds as they go through their residency experience, but sometimes we do like to get to know those that are focused on primary care versus specialty, because we could sometimes give you more rotations in outpatient areas if that's more of your interest.
Of course. So going in now, my interest is kind of split. I'm very interested in infectious disease because I have a lot of history working with international areas, and I have interest in global health.
Yes, I did notice that on your application that you had gone to different places.
Yeah, but I do love critical care as well. I love procedure heavy training. I love working in that environment. For me, it's a real draw. And I know they're two different areas.
Yes, they're very different, but that's okay. Like I said, there's no wrong or right answer to that question. Is there anything else about our program that you would like to know about that you didn't hear already from talking to the other residents while you were waiting to get interviewed?
What is it you're looking for when you pick your residency class?
Okay, that's a good question. Certainly there's not just one specific thing that we looked for. We do have to look at the exam scores, which, that's what they are, and your GPA from your medical school, and also some other things that you have done and letters of recommendation that you have done and how you've done in your clinical rotations. Certainly, if you have done electives and gotten recommendations from them that are very favorable. And research is also looked at. It's not as heavily looked at as the GPA and the STEP scores, but if you've had anything published, which I think I saw one, was there anything published that you had?
Yeah, it recently being accepted, and at the time I put this in, it was being accepted at the time, but it was used at the conference for the AMA in Hawaii. Okay.
And certainly we look for red flags, for example, students that didn't pass one of the exams, but that's not applicable to you, so you don't have to worry about that. What else was I going to say? So, and also the interview process, of course. We'd like to get as much information from you as a person in the short time that we're talking to you, which we understand it's a snapshot in time. But we will, take that into consideration. And the other thing I just wanted to ask you about, which you probably have been asked before, you did have some time between college and medical school. Was it because you weren't necessarily going to be pre-med in college and then later on changed what you wanted to do?
So yeah, when I graduated college, initially thought I was going to become a diplomat. That was my whole plan.
Oh, wow.
I was about to take the State Department exam. And
well, you'll handle the politics of the hospital very well.
The morning I was supposed to take the exam, something in me realized that I'd been going to Africa a lot at that time, and I realized that wasn't the path I wanted to follow. Okay. And so I graduated, packed my bags, and moved to South Africa.
Wow.
So I just moved to the village I'd been volunteering in. I spent a year there. And then I came
that
back.
Must have been some amazing,
it was amazing
experiences there.
And I came back and I started my pre-med course as a post-bac while working in the hospitals.
Oh, wow. So you got some sort of clinical exposure while you were studying for the prereqs for med school?
What I first did was I got my EMT license because I was like, this is a big decision. I need to make sure medicine is right. So it was a good way for me to find out.
Sure, yeah. You get right thrown into seeing patients that often don't even, look so clean. So, right at the scene. And so did you enjoy doing the EMT work?
Oh, it was great. It got me, so I got my EMT and I got sent over for Hurricane Katrina with the Red Cross. And with them, I worked for...
Oh, so you were down there?
Yeah, I went after the hurricane. And then from there, I made connections so I could start doing clinics in Mexico. And so I did a few clinics in Mexico after that. And then I started
a lot of international experience.
And then I came back to the States and started my post-bac pre-med courses and working at UCSF.
Okay. Are you from California originally?
I am.
Okay. How do you feel about where you want to be geographically? Like us being in the Northeast, is that a good thing for you? I know you're from the West Coast.
For me, actually, I've been out here for the past couple of years. My fiance is out here. We've kind of built our community in this area.
Okay. Yeah, certainly they're different.
Yeah.
And that doesn't mean you can't never go back to California
That's
after
right, sure.
you finish. Like you said, you may go on for more fellowship training and then decide what you want, where you end up.
Yeah.
And certainly that's that's something you can decide down the road. Let me just ask you another question. Certainly, we looked at all of your file and we have a good idea about you from what's on paper, but is there anything about yourself you'd like to tell me that I can tell the others when we review you as a candidate for our program that would make you stand out?
Make me stand out.
Or something you'd want me to know that I wouldn't maybe find out from reading, the letters of recommendation that are going to say how good you are and how wonderful you are.
Maybe I have a lot of different interests. I feel helps to try to keep me a little well-rounded.
Okay.
Such as I love medicine, but I also love to volunteer, run. I like to write. I'm working on a children's book right now, actually.
Oh, really? That's fascinating. What's that children's book about?
It was triggered initially when I was working in South Africa. It's about, actually it was a children's book about clouds and how their different relations with the sun and how the different seasons were developed.
Oh, wow. I think that would be a very interesting read for even non-children. So that's great that you're very well-rounded, and, I think that helps to make you a better physician, actually, because you become more relatable to people, able to talk to them and make them feel comfortable, perhaps pique their interest in, because when patients are in the hospital, they're their most vulnerable state.
Yes.
So if being able to have a conversation, if you have all these interests, you probably have a lot you can talk about with them and make them feel at ease. So I think that, you look like you have a lot of experience. You certainly seem very mature, which is another thing that we look at when we're evaluating our candidates, people that are ready to take on the responsibility of a resident physician. Is there anything else that I could help to sort of give you more information, insight to our program, anything about me specifically that you'd like to know?
Yes. What keeps you here at the program?
So I think what I think makes this a great place to be, a great place to learn, is something that you touched on when I asked you your first question, which is that we do serve a huge variability of types of patients and their pathology. There are things that you read in the book that you think, I'm never going to see that, and you'll see it here at our institution, which makes it a great place to learn. I think the more exposure you have to different things, the better you are if you wind up being in a big city or a small city in the middle of the country where there's not a lot of other places around that serve patients. And we're a very friendly place. We're very warm. We make you feel like you're part of a family. And I think that is another draw for me to stay, always feeling that I'm wanted around, and that that people respect my professional opinion, but also like me as a person, which is nice. And we won't just think of you as, oh, who's that resident? No, we'll know you're Justin. You're a good friend, a good member of our team. So you won't be lost. And we are somewhat small in the sense that you'll get direct contact with your attending physicians. There are some fellowship programs, like you mentioned, but there are also opportunities to work directly with the specialists, and that will give you more exposure to that. I think that all the residents seem to be very collegial. They like to help each other out. what else can I tell you about? And I think it's we're close, to places for you to do things in the community, like you mentioned. You wanted to go into the community. So we do have a lot of community outreach programs. Is that something that interests you at all?
Yeah, actually, I volunteer with a couple of community programs out here.
Okay, great. So you can always bring those ideas to us. That's another thing that I think you'll like about our program is that if you have an idea and a plan and you present it in a well thought out manner, it often can get picked up and done. And there are resident-run grants that you can apply for from different societies, and you can get precepted by someone like myself, but you can really run the show, and that's another great thing. Certainly there are a lot of community needs. We still have a lot of patients that suffer from obesity, that suffer from diabetes, that are just poorly educated, and asthma and COPD, and you can get out there and reach out to them and hopefully broaden their awareness of how important their health is on their future and for their children as well. Obviously you have an interest in children with your children ready, so no interest in going into pediatrics though, huh?
No, unfortunately.
Yeah, I just thought, I was just curious about that because you mentioned the book, but no,
that's my fiance's area. That's what she's.
All right, so between the two of you, you'll cover everything from birth and on.
Exactly.
So that's great. I see that you've done a lot of good things in your past, so I think that will definitely help you as a candidate. We've been talking for a while, but there's something I did want to bring up, which you may or may not have had this question asked of you on your other interviews that you've gone on. As we've talked about, you have some great work experience, and your GPA from medical school does look very, very nice. However, I was surprised to see that your Step 1 score, although you passed, wasn't as high as the number that we usually look for when we're taking candidates. But we did want to interview you because, like I said, your GPA was good, your letters of recommendation were very, very good, and your personal statement was very well written. And so maybe you can tell us, why we should sort of let that slide and welcome you into our program.
Of course, thank you for bringing it up. Actually, it's good that I get to address it. So the week I took my STEP exam, I'd come down and become very sick. And my studying it had taken a hurt. I couldn't study as much as I normally would. And going into the exam sick, it's a very long exam. And you feel the drain coming.
Sure.
And unfortunately, I feel that was the reason my score suffered. On all my practice exams, I'd been doing very well, so I felt confident going in. And that's why I didn't postpone it.
Yeah, because that was going to be my next one. And also maybe it might have gotten too close to the date to change. I don't know.
Exactly.
I don't remember what the rules are.
But my previous practice exam the week before had been very good and been what I wanted, so I thought, okay, I'll be okay. Don't postpone it. You're just putting it off. So I thought I could do well on it, and unfortunately it didn't work out. But I felt it was one day, one test, and I feel I worked really hard in medical school, and I feel my grades help support that. I do understand the basic sciences. But when I did take the CK though, I did score a 235, and I was hoping that would help redeem to show that it wasn't just a one day, one test.
Well, that is a very good point that you make. We do look to see if we have candidates that have a lower Step 1 score. We do look to see that there's a nice size jump, and certainly from your, under 200 jump to 235, I mean, that is an impressive jump. So we will definitely keep that in mind. But it is a question that is going to come up when we're reviewing your file, and so I figured if you can give me the insightful answer, then I can share that with my colleagues, and hopefully that could possibly help you to be chosen for our program.
No, I appreciate your help.
Okay, so I just wanted to just review some specific things about your file. I'm glad that we've had some conversation about what you're looking for in a residency and what we can offer you. And you do have some good experience, like we've said before. But we do have to talk about examinations, because even though it may be frustrating, it is one of the parts of our evaluation when we decide which candidates we're going to rank and how high we're going to rank them. So your Step 1 score, great. Your Step 2 CK, also very, very good. Can't criticize either of them. However, I did notice that the CS you didn't pass, and I was very surprised, looking at everything else on your record.
Yeah.
So what happened that day?
So With the CS, unfortunately, I feel I took it too early in my clinical years.
Meaning you hadn't done...
I hadn't done my medicine rotation yet.
Oh, you hadn't done medicine yet? Oh.
Everyone had told me, it's very easy, you can just go take it. You could study a weekend and it'll be okay.
Really?
So,
well, I wonder where that information is coming from. We need to figure that out for future colleagues. Yeah, that's not good information.
So I feel I approached it unprepared, unfortunately, and that's where my score showed. But since then, I've retaken it. I've had my meds, completed all my 3-year rotation.
Because that's what, guys, you had when you took it the second time. Had you done all your core rotations?
Yes,
okay.
I had done my core rotations. I retook it in December, so unfortunately my score's not ready yet, but it will be there in time.
In time for when we have to submit our list.
Exactly.
Okay. That's good. Did you feel a different experience your second time around?
I felt much more prepared. I was much more comfortable working with patients after the first time.
Which makes sense, right? Because you have gone through more clinical exposure to real-life patients on the wards in the hospital that you were rotating at.
Exactly.
So that's going to broaden your confidence and help you feel more at ease when you're talking to these, actors that are pretending to be patients. Well, that certainly makes sense. I'm sorry that unfortunately you got bad information about it being, an easy test. That doesn't require any preparation because, as you know, it does. And that's the one test that we look at in a sense that's a little different because the other two tests are very much knowledge-based, but this is sort of a test on how you're going to interact and communicate your interpersonal skills with patients. But, you're going to meet me today and a few others, and we'll get a more taste of how you interact with us as... and also, we will read your letters of recommendation, which so far the ones that I looked at do look very nice. So I do believe you that it was poor information given to you and that you, like you said, you weren't prepared. But I hope that when we get your score back that it's a pass because, as you know, being an international graduate, we cannot put you on the rank list until we get that pass back. So we got the 2 boxes checked, step 1, step 2. You just need that 3rd box checked, and then we can talk about considering you as one of our possible candidates.
Excellent, thank you.
So I see that on your file you are participating in the couples match, and your wife is applying for which area?
Pediatrics.
Okay, for pediatrics. And so I was just wondering if you could just tell me a little bit more about your experience with the couples match.
Of course, yes. So far with our experience with the couples match has been very positive. What we've learned to do is when one of us has received an interview at a program, the other one has then after that contacted what they are applying into just to let them know I'm couples matching. Okay. My wife has been accepted an interview, we're trying to coordinate our interviews to be together to save on travel expenses.
Sure.
And usually there's a good response back at that point.
And are you applying to a few different geographic sort of cities or areas? Do you have to do that? Does that help you?
Yeah, so with the couples match it's recommended we also apply to many more programs than you normally would due to the fact that you have to create combinations with the programs you bring.
Right, and you're applying for internal medicine and she's applying for pediatrics. And so I guess most of the institutions may or may not have, both of those programs available.
Exactly.
So sometimes if there is the opportunity for both programs to be there, is that when you're saying you ask them if you say, well, my wife is interviewing,
yes,
can I possibly come for an interview? Or how does that go?
You can actually do that as well as the other one you could do is I'm couples matching. She has an interview in the area we're trying to contact. You don't have to didn't necessarily have to be the exact hospital, just that the area.
Oh,
a lot of them are very understanding that the process is very expensive and understanding of your travel.
Okay. Is there anything else about the experience that you could tell us about that would just give us more, information about the process?
Of course, yeah. So it's very important when you're doing the couples match as well. I think the most complicated part of it is your rank list. When you make your rank list, you have to make them match up and link your applications. But you have to place every single possible combination on your rank list. Because if you don't get that combination, it doesn't mean you now move on to the next one. Even if one person got into their first program, if the other one didn't get into the first one, it moves to the second. So you have to think of every possible combination to do. as well as you have to place the ranking where one of you doesn't match and the other matches.
Wow, that's very interesting. So even if you could put hospital A and hospital B, and then put hospital C and hospital D, like all the different permutations?
Yes, so what we would do is we put for her hospital A 5 times, and then I put the 5 hospitals in that area, and those would be our first 5 ranks.
Oh, okay. All right, so that way that makes sense. That way you have a better chance of getting your priority choices and still not be too geographically far from each other. Is there anything else you want to say about it, or is that about everything that you wanted to last time?
With the couples match also, you don't want to approach the place and say, I'm interviewing here and I won't interview unless my partner gets an interview. You have to be very polite about it. Mention to them just that we are trying to couples match. A lot of them do like to know up front, even though it's not required, that you are couples matching.
Right. Okay. That makes sense. Okay, I'll let my colleagues, so some of my colleagues just have a few questions about it, so that will definitely help them understand it better. Thank you for all that. So now what we usually do as part of the interview process, and you may or may not be expecting this, is we do like to ask you a clinical scenario just to get an idea of how you would manage patients and what your level of comfort is with that. And don't worry, we're not going to ask you anything that you wouldn't have already been doing on your CS exam or in your actual internal medicine rotation, or perhaps if you did an emergency medicine rotation. So we're going to have a 55-year-old man who comes to the emergency room with a chief complaint of some chest discomfort. As he's there, he's put on a monitored bed in the emergency room, and he is doing okay initially, but then you get a phone call from the nurse who tells you, patient so-and-so, 55-year-old man, was doing okay, but when she came to check on him to do his vitals, she noticed that he was diaphoretic and complaining of substernal crushing chest pain. What would you tell the nurse to do? Because she can't do anything without your orders.
I'd ask her first to give the patient aspirin as well as nitro and get an EKG, and let her know I'd be right down there, as well as put him on oxygen.
Okay, very good. That all definitely makes sense. So all of that's taken care of. You get there as fast as you can, and when you arrive, the nurse tells you that she completed all your orders of the medications that you asked her to do, and she shows you the EKG. When you look at the EKG, you notice an abnormality. You notice that there's ST elevations in 3 leads, 2, 3, and AVF. What does that make you think of? Which diagnosis?
Sounds like he's probably having an inferior wall MR.
Very good. So now what do you want to do?
From now on, I'm going to contact cardiology, have access created for the patient. If he's still in pain, give him morphine, as well as consider starting a nitro drip.
Very good. And let's assume it's a hospital that has a lot of cardiology patients come, so they actually have an active cath lab. Would you also activate that, call a code for that if that was an option?
Yes.
In our institution, what we usually do is we say, STEMI in the ER.
Yeah.
And everybody knows to run and get that patient to the cath lab as soon as possible.
Yeah, I used to be a tech at UCSF and ED, and that was my job, was to get all the monitors on them and everything, but we had the fastest time in the nation when I was there.
Oh, wow. Oh, so we know that you can move on your feet. That's very good. And the other thing is, are there any other medications that you would give specifically for the heart? We talked about the nitro and the morphine, but it's a type of medicine we also use for blood pressure.
So that's a tough one, because with beta blockers now, there's a lot of different arguments, and some have been saying it actually doesn't help and it could be causing detrimental.
Very good, very interesting. Yes. And
the time factor on the beta blockers the benefits weren't necessarily if you gave them immediately.
Okay, wow. So you've done your research. That's very good. And what blood test can I order now to confirm the diagnosis?
You do cardiac enzyme.
Very good. All right, I think that you really understand the concept well. So that basically exemplifies the record that we've already reviewed, which is your Step 1 and Step 2 scores and your CS pass rate. So I think we can end this discussion now.